He is a medic who has been involved in the treatment of patients that were air-evac from the mainland of Africa onto the ship that he was on off the coast. He took care of quite a number of different kinds of patients, people with fevers and diarrheas and the usual tropical diseases you see in Central and West Africa. He knew for sure that some of the patients had typhoid and some of the other common diarrheal illnesses. He himself has had to be on the ship until about 5 days ago, and he came back to the U.S. He had been sick before he left the ship with diarrhea, high fevers, general achiness, nausea, vomiting, chills, and upon arrival to this country, he got a little bit better in terms of his overall symptoms, but yesterday just felt so wiped out that he decided to come in and be seen with the concern. Of course, he's well informed, and again, as a medic, he's trained to think about these things. He came to us with these concerns, plus he's had significant weight loss and dehydration. So he came in. We did not have him linger at all in the waiting room. We put in our infection control practices right away, put a mask on him. Didn't have him have contact with anybody on his way in, whisked him right back to the room that we have specially appointed in the emergency department for this, where our staff, who are entirely in personal protective equipment, PPE, with face shields, masks, impenetrable gowns, leggings, booties, evaluated the patient. He was very forthcoming and said that he had been taking care of patients from the areas that are known to have Ebola. He said that on his ship, he didn't know of any specific patients with Ebola, but then again, he didn't have the ability to test for Ebola. So it's, to us, an indeterminate history in that sense, but one that's worrisome enough that we thought that we needed to put the proper safeguards in place. I would expect so, yeah, especially since he's getting no worse. If he had a really bad case of Ebola, we would expect to see that he would get worse, actually, because he's in the early, if the symptoms he had would be fairly early in the disease course, and we have access to the things that other organizations too. If should experimental drugs, vaccines, antibodies, and those kind of things be considered, we wouldn't implement those things until we had a positive test.
Can you take us through that disease course if it does come back positive?
Yeah, and it's extremely variable. Just like, and I'm sure you know, people that get the influenza, bona fide influenza, some get it and have sick for 3 or 4 or 5 days, and some people are down for 2 weeks. Every disease has its own kind of unique pattern in any given individual. But overall, the kind of the high level view is that a person gets exposed to and the Ebola virus enters their body. They have a variable length of time, 4, 6, 8 days is more than normal of incubation period until they start getting symptoms. They have a few days of the kind of the early, almost influenza-like symptoms, and then a few more days where they start having worse gastrointestinal symptoms, fluid loss, dehydration, and then the last stage, which is what we call the organ failure stage, where they've lost so much blood, they've lost so much fluid that they're not circulating blood well to their liver, their kidneys, their brain, and they start, the thinking processes get off, they don't oxygenate well, their kidney and liver don't work well, sometimes they need kidney dialysis and that kind of thing. He's nowhere near, if he were to go to that stage, he's nowhere near that yet, and hopefully if this is indeed what he has, we're in that first early phase or just barely into the second phase of illness. And again, I hope that's not what his destiny is, to progress along that way. And given these first 12 hours, I think it's reassuring.